Hey again, we have been going a little more deeply into the shoulder girdle because we know it's complicated. Regardless of its complications, the shoulder girdle is the top of the tree and we have to build it from the roots up. But we've been trying to work our way through that way. And I wanted to just maybe show you some pictures of a shoulder blade, plain and simple, because I think we often think of it as somewhat of a flat triangle, but it has many parts that kind of fly off of it. Okay, so if we're looking, obviously here's the collarbone, we've removed the rib cage and we're looking at the inside of the back of the shoulder blade. But this gives you a really good view of that coracoid process and how it's just like a little jutting finger of bone that comes off the blade itself, right, and protrudes quite forward under the collarbone around the side of the top of the rib cage, right? And the arm bone attaches here, so any muscle that's pulling on this or that or this or that, right, is going to pull the shoulder joint into a bad position. And here we are looking at it from the back, and you can see this huge, beautiful blade of muscle that sticks off the back of the shoulder blade, right? And it's a huge player in muscle attachments. And we're going to look at the rotator cuff. They've almost kind of nicely outlined it for us in the back of the shoulder blade. So I think it's just really helpful to try to get a three-dimensional picture of a shoulder blade going, because aside from that flat triangular bit, there's that protruding coracoid process, and then that kind of flying piece of bone off the back of it, the spine of the shoulder blade, that becomes also the acromion process to which the collarbone attaches, right? So I think a lot of times trying to figure out muscles, it's not so understandable until you get a better picture of the actual design of that bone. Okay, so, and again, these pictures are coming from that manual of structural kinesiology I mentioned. Okay, and we'll look into the rotator cuff next.